Hello everybody, I'm Liburn Grabovci, and I'm very honored to be able to present in this conference. One of the two presentations I prepared today is titled Improving Quality of Life Among Cancer Patients in the Modern Era. This presentation is prepared by me together with the help of my mentor, Professor Prishtina, and the other co-authors, which I've mentioned below. So I'm the first author of this presentation. I just graduated from the Faculty of Medicine in Prishtina, Kosovo. And right now I'm collaborating with Professor Tai, who is also my mentor, and we're preparing some presentations and papers together. So we all know that cancer treatment may lead to a wide range of complications, which may be acute and chronic. Acute complications may include nausea, fatigue, infections, pain, stomatitis, and so on. As far as chronic complications go, or long-term, they may include neuropathies, hormonal imbalances, sexual dysfunctions, emotional disturbances, and so on. Now, for this work, a literature review was conducted for the past decade to identify strategies aiming at improving quality of life and to manage post-treatment complications among cancer survivors. Now, we've seen that a quite common complication which happens in patients who are treated with radiotherapy is radiation-induced skin dermatitis. Now, radiation-induced skin dermatitis varies based on the dose and comorbidities, genetic makeup of the patient, but it has been seen that intensity-modulated radiation therapy may reduce the complications which are due to radiation. So some of the complications which we may see due to radiation might be telangiectasis, ulcerations, and the most severe form might be skin fibrosis. So treatment of these complications may be for telangiectasis. The only method which has been shown to be efficient is pulse-dye laser therapy. For chronic ulcerations and necrosis, there have been two case reports which show two different methods for treating this condition. One of them was low-intensity laser therapy, and the other one was using recombinant platelet-derived growth factors together with a hydrophilic copolymer membrane. As far as the most severe form of this complication, which is radiation-induced fibrosis, there have been some treatment methods, including vitamin E, hyperbaric oxygen therapy, laser therapy, and so on. If the condition is more severe, surgical interventions may be needed. Now, here I've shown some of the methods which may be used. So we can use pentoxifylline and vitamin E for as long as 6 months. Hyperbaric oxygen chambers, which are a little bit pricey, costing $15,000 for treatment. Surgical debridement, grafting, flap coverage, and also another method called photodynamic therapy, which if you want to go more in depth about this treatment method, then my professor has done a paper talking about this method. Now, another complication, which we see quite often in patients who have undergone treatment for head and neck cancers, is lymphedema. Lymphedema is due to inadequate drainage pathways for the lymphatic system, which occurs in up to 75% of patients. Now, a method which has been used and has shown quite positive outcomes is submental liposuction. Now, submental liposuction has been shown to significantly improve self-perception and self-confidence. Some other methods which may be less invasive are pneumatic compression devices and kinesiotaping. Now here I've shown photos of patients before and after submental liposuction to see the improvement in their facial features after the treatment. Another complication which we see in patients who use doxorubicin is cardiotoxicity. So AI system was made called Cardio AI, which helped clinical providers to assess cardiotoxicity earlier and may be able to intervene earlier. Now, this Cardio AI system is composed of 5 modules. Module A, B, C, D, and E. Module A is used to show patients basic information. So basically the cancer type, treatment plan, and so on. The module B is a daily summary, which may report new symptoms, data, and other data. Module C is wearable sensor data. It shows the heart rate, the blood pressure, skin temperature, oxygen saturation, and so on. Module D calculates the risk for cardiotoxicity and makes it easier for medical providers to be able to identify cardiac toxicity earlier. And module E is a conversation log, which displays the patient's spoken reports. Now, another complication is urinary incontinence, which may be seen in patients who have undergone radical prostatectomy. So one study took 43 men who had undergone radical prostatectomy and did a modified pelvic floor exercises using a resistance band. Now, the study aimed to look at urinary incontinence scale, incontinence impact questionnaires about quality of life, hospital anxiety, and depression scale. Now, measurements were taken 2 weeks, 1, 2, and 3 months after catheter removal. And what the study found is that urinary incontinence decreased, quality of life improved, anxiety and depression had also decreased. And the reason for this improvement is due to the use of the resistance band, which made it better, which may lead to better contractions of pelvic floor muscles and making the exercises more successful. Now, another problem which is quite common is sexual dysfunction. So, especially women after cancer treatment, they may face sexual problems like pain after sexual intercourse and so on. So in Canada, they tried training session, which was 30 to 45 minutes long, which basically they had a lecture about sexual dysfunction. They used patient provider scenarios, and also they implemented a new technique called Did You Cord Her? Now, CARD is an acronym which stands for Context, Assessment, Recommendation, and Documents. Now, context here is basically that the medical provider should know a little bit about the patient, so the cancer type, the treatment methods which are being used for this patient, and so on. Assessment is basically we ask her about the sexual problems she's facing. At our recommendations, so we give her recommendations about treatment methods and how to overcome some of the problems which she is facing. And documentations is so that we document every time we have a talk with the patient. Now, findings from this training showed that it increased comfort of providers discussing sexual issues with patients, improved knowledge, greater frequency of initiating conversations about sexual health with patients, and interactive elements like role play and peer feedback were rated as highly valuable by participants. Another problem, quite common in cancer patients, is psychological problems. So which may be like anxiety, insomnia, stress, and so on. Now, a study looked at some digital psychological interventions to see how effective they are in treating these problems. Now, some of them were digitally delivered cognitive behavioral therapy, health education, and virtual reality therapy. Now, the results showed that CBT and VRT both improve quality of life in patients with anxiety, depression, and fatigue. Only CBT improved effective in alleviating insomnia, and only mindfulness-based interventions significantly reduce fear of cancer occurrences. Another problem which cancer patients may face is osteoporosis, which may first be shown as osteopenia, and then it may progress to osteoporosis and eventually to fractures. Now, there are some pharmacological and non-pharmacological methods which we may use to prevent this from happening. In non-pharmacological managements, we may use dietary supplements like taking vitamin D, calcium, amino acids, reducing coffee intake, alcohol, smoking, doing exercise, and so on. In pharmacological management, we may use biphosphonates like alendronate, risedronate, and so on, denosumab, bone-forming agents like teriparatide and abaloparatide, selective estrogen receptor modulators, and calcitonin. Now, as a conclusion, we saw that chronic radiation dermatitis, including fibrosis and ulcerations, remain difficult to manage, though techniques like intensity modulated radiation therapy help reduce the severity. Head and neck cancers which may cause lymphedema are being treated with liposuction, submental liposuction. AI-based tools like cardio-AI offer new possibilities for early detection of cardiotoxicity. Rehabilitation strategies such as resistance-band exercises improve urinary incontinence and psychological outcomes after prostatectomy. Sexual dysfunction remains under-recognized, but provider training programs enhance care. Digital psychological interventions effectively reduce distress and improve quality of life, and bone loss due to cancer therapy increases fracture risk, requiring timely preventive interventions. Overall, a comprehensive survivorship care must address physical, emotional, and technological dimensions to improve long-term outcomes for cancer patients. Now, here I want to thank the people who made it possible for me to present here today. Them being Professor Kevin Wong, Professor Maha Subi, Professor Osama Sued, Professor Vimal Prapajati, Mr. Omar Alkais, and also my friends Laurent Ciarina and Melissa Stubla. Other people which I like to mention are Glenn Bauman, Andrea Beziak, John Ho, Rashmi Cole, Kurian Joseph, Jake Van Dyke, and last but certainly not least, my professor Patricia Tai. So this was my first presentation. If you have any questions, feel free to ask me. And also, if anybody wants to look at this presentation again, I've posted it in ResearchGate. Thank you.